So now we're going to talk about hypertension. And hypertension, very common problem. 25% of the U.S. population has hypertension. But hypertension is typically asymptomatic until much later on when it's caused problems. And the problems it can cause, it can contribute to coronary artery disease, strokes, cardiac hypertrophy, even heart failure. The mechanism of hypertension is we would call it idiopathic for the most part, and we call this essential hypertension. But we know that hypertension is thought to be a blood pressure of 140/90 or greater. And one of the other things that a lot of people say when they talk about hypertension is that it's the silent killer. And so again, it's causing all of these issues, but most people don't ever even know they have hypertension. And some people, they get really lucky. They'll know that they have it because they get headaches. Sometimes they can get kind of angry and grouchy, or they can feel very jittery and nervous. But most people have no clue. So essential hypertension can also be called idiopathic hypertension, primary hypertension, even benign hypertension, and it could be due to just genetics. So for instance, people have a tendency to have problems with renin, angiotensin, aldosterone system, if you remember that. If you don't, you can look that up in the blood pressure video for physiology and watch that again, which wouldn't be a bad idea. You can also create hypertension due to lack of exercise, poor diet, like maybe you're drinking too much Coke and you have way too much caffeine in your diet, and lots of stress, and then of course obesity can lead to hypertension as well. Secondary hypertension is caused by conditions like, for instance, renal failure, conditions that affect the arteries or the heart, even endocrine system conditions like maybe Addison's disease, where you're not controlling your minerals appropriately. And then malignant hypertension. This is a type of hypertension that just comes on suddenly. A lot of times we see this in the elderly, in our geriatric patients, and they have a very high diastolic pressure. And this could be due to, let's say, the elasticity of the arteries breaking down, because the diastolic pressure is all about the arteries. And the systolic pressure, if you remember, is all about the heart. And so we see this as arteriosclerosis comes on in the elderly. So essential hypertension or idiopathic, we don't really know what that is, but it's probably related to, like I said, the RAA system. So we have reduced renal sodium excretion. We may have vascular changes, genetic factors, environmental factors, and so on. So what we get with essential hypertension is accelerated atherogenesis. So that is the thickening of the arterial walls. It's a type of arterial sclerosis, or the hardening of the arterial walls. And it could create what we call aortic dissection, which we're going to talk about in a little bit, and then also stroke, which we know is lack of blood flow to the appropriate areas in the brain. It also causes small blood vessel disease, and what happens is you get what's called hyaline arteriosclerosis. And so what happens is a hyaline starts to form around the vessels, and this hyaline tissue hardens the vessels. You can also get what's called hyperplastic arteriosclerosis, and this is what is referred to usually as onion skin arteriosclerosis, and the vessel is thickened, the lumen narrows, because you get more layers of smooth muscle, and then you also grow more basement membrane, and that pushes the endothelial lining into the lumen and narrows that lumen. So in this picture, you can see, get the laser pointer here so you can see this. This is the hyaline, excess hyaline that's growing around this blood vessel and making it very thick, and the lumen is very small here. Same thing here in this picture. You can see that hyaline creating that arteriosclerosis. Excuse me. So we also have problems with aneurysms when we look at blood vessels. And there's two types of aneurysms. There's what's referred to as a true aneurysm and a false aneurysm. Now, a true aneurysm is where all three layers of the artery are involved, and a false aneurysm is where you get a hole in the artery that's covered by a hematoma. So let me show you this picture here. This is a true aneurysm. So we have all three layers of the intima involved, and what's happening with this aneurysm is that the wall of the artery is sickly. It's breaking down, it's become too stretchy, too flexible, usually too thin, and because of the blood pressure that's coming into this artery, it's pushing on that wall and causing it to bulge out like this. So here's your normal blood vessel. And then here's a false aneurysm. Somehow we have some type of hole in the arterial wall, and blood then is pushed out through that hole, and what it does is it pushes the tunica externa out and accumulates in this pocket here. Both of those, as far as aneurysms are concerned, they have a high probability of rupturing. So causes of aneurysm can be atherosclerosis, cystic medial degeneration of the wall. By the way, that can be genetic. And then, of course, trauma, and then congenital defects or infection like a mycotic aneurysm. Now, let me just take a second and talk to you about the difference between genetic and congenital defects. So if something is congenital, that means it happens in just me. If I have a child, I don't pass this defect on to my child. If it's genetic, then that does mean I can pass this on to the next generation. And aneurysms quite often are genetic. They do run in families, even berry aneurysms. So for instance, in my family, there's a very high risk of berry aneurysms. I have, to my knowledge, 20 of my relatives who actually have died from berry aneurysms in the last 2 generations. And then that doesn't include those who they caught the aneurysms early on and were able to survive from it. So you have to be very careful because the risk is very high running in families. Now, there are different types of aneurysms. They can occur pretty much any place in the body. And so, for instance, like a berry aneurysm, that occurs in the base of the brain, and I'll show you some pictures of that. There's also abdominal aortic aneurysms. Now, usually men are more susceptible to this, and especially over the age of 50, but that's not always the case. I have an aunt who had 12 abdominal aortic aneurysms, and luckily they did find those and were able to repair them, and I'll show you how that happens. Atherosclerosis can cause this. Genetic defects like Marfan syndrome. Now, Marfan syndrome is an interesting genetic problem where the person doesn't make the appropriate amount of connective tissue, and so it makes the walls of the arteries in particular very weak. There's all kinds of other issues with Marfan syndrome. The abdominal aneurysm, you can see this as a pulsating abdominal mass, and then it can rupture, and of course that can lead to death. So you have to be very careful. Now, this picture right here, you see right here, this is a berry aneurysm. So this is occurring on the base of the brain. This is the circle of Willis. And so this is the aneurysm that absolutely should not be there at all. And then this is a ruptured aneurysm on the base of the brain. Here is the abdominal aortic aneurysm, and now what they're doing is they're going to cut this out and then fix this blood vessel. And then here's one, unfortunately, that did rupture. This is the aneurysm, and you can see where it ruptured, and they opened that up so you could see it a little bit better. How they fix this is they cut the aneurysm out, and then what they do is they insert basically a Kevlar tube. And that tube is sewn into the vessel, and then you replace the tunica externa around that, and it works extremely well. And now you have a stronger abdominal aorta than you had even before. Now, one of the other problems that can happen, aneurysm or not, is aortic dissection, and you see here you have this hole that occurs from the breakdown of the wall of the aorta, and now blood is coming in and it's dissecting or pushing out the tunica externa. Now, again, what could happen here is you could have the entire tunica externa actually pushed out. It makes the wall very weak, and then blood fills that cavity or that channel, and you can see here the different ways that this can occur, and then eventually you have rupture of this aorta, and again you have what we call exsanguination, which is bleeding internally, and the person can potentially die from this. So it's a separation of the aortic wall. Small tears become larger, and it leads to bleeding. And like I said, it can go through the tunica intima, out the externa, creating a channel. A lot of times we see this, most cases with hypertensive males between the age of 40 to 60. It's a sudden onset, and they have excruciating pain from this, and unfortunately it can rupture. Now, when it ruptures, it can cause death due to hemorrhage, massive hemorrhage, or it can create what's called cardiac tamponade. Now, cardiac tamponade, you remember we have this pericardial sac around the heart, and that sac is already filled with fluid. Well, if you add any extra fluid, for instance, blood, to that sac, and you add as little as, let's say, 50 milliliters of blood, what can happen is it can compress the heart to the point that there's so much pressure on the heart, it actually makes the heart stop. And that's what we call cardiac tamponade. And of course, this person can die. So if there's rapid diagnosis and surgery is done to repair this, there's a 75% chance the patient's going to survive. All right, so now we're going to go on to vasculitis. And vasculitis is inflammation of the vessel walls. And there are many symptoms to this. But basically what's happening is you have some type of infection, or you have some type of immune-mediated issue that causes vasculitis, okay? Maybe some kind of hypersensitivity issue going on. So one type of vasculitis is called giant cell arteritis, and this is the most common type of vasculitis. So in vasculitis, we see what are referred to as granulomas, and this is that inflammation in that picture that I just showed you. And this inflammation can be found in many different types of disease, but in particular, we do see it in vasculitis. Now, granulomas occur due to the fact that macrophage come into the area and they create this inflammatory response. And we see this mostly in patients who are above the age of 50, and it can become a chronic problem with this inflammation of large all the way to small arteries. We see it especially in the head, and I'll show you a picture of that. Symptoms can be very vague. You may have fevers or headaches, even loss of vision can occur. But treatment, basically corticosteroids. So we're going to give them some type of anti-inflammatory type of drug. And so in this picture here, you can see the arrows, they're pointing to the granulomas, and all those little blackish purple dots, those are all the macrophage that have moved into the area. Okay, so you can see we have all those little black dots there, all in through here. Those are the macrophage. This is the giant cell arteritis, and this is a granuloma, and so we have all this swelling that's occurring in that area. Very common right there in the head. Takayasu Arteritis is pretty rare. Again, inflammation of the blood vessels, and you get this granuloma, but it's occurring in the aortic arch. And so what we see is narrowing of the major branches coming off of the aorta. And now because blood is having a hard time, because you have stenosis or that narrowing occurring, you don't have as great of a heart rate in the extremities. So they sometimes call this a pulseless disease. And the symptoms can be fatigue, weight loss, general aches and pains, and this is again just due to ischemia. And we see this in women usually under the age of 40. Now notice in these pictures, here's the aortic arch, and you can see all the stenosis that's occurring. And another just kind of cartoon picture showing you the potential for stenosis. Polyarteritis Nodosa, this is also a rare disease, not quite as rare, and again, inflammation of the blood vessels, but it leads to necrotizing vasculitis in many organs. And that simply means that because there's not a lot of blood flow, you start to see necrosis of the internal organs, okay? And you can have different stages of this in the same length of an artery. It has varied symptoms, and you need those steroids to reduce the inflammatory response. Possibly even an autoimmune type of thing that's going on, and usually this is in young adults. And you can see the outcome here on the back of this person's legs. This is just necrosis, okay, and not good. Excuse me. And then here, all these dots again, these are all the macrophage, and this is a blood vessel, but there's a thrombus that's totally occluded that blood vessel, which then leads to that necrosis going on. Now, Kawasaki's disease, this is a rare condition in children. It also involves inflammation of medium-sized arteries, and that would include the coronary arteries supplying the heart. It is an autoimmune disorder and can also affect the mucous membranes, lymph nodes, and walls of the blood vessels, as well as the heart. So the symptoms include a high fever that's very persistent, bloodshot eyes, bright red chapped or cracked lips, really bright red mucous membranes, and then what we call a strawberry tongue. And the tongue sometimes looks like it's been dipped in, like a strawberry dipped in powdered sugar type of effect. And then skin rashes, but not blisters. So this happens typically under the age of 4. And can be self-limiting. So with an autoimmune disease, they get like a breakout or what's called a flare-up, and then eventually it will potentially go away, especially if corticosteroids are given or intravenous antibodies like intravenous IgGs. So here's Kawasaki. You see the cracked, swollen lips, swollen fingers, lots of edema, and then here's the strawberry tongue, okay? Very common in Kawasaki's disease. Wegener's granulomatous is, it affects blood vessels in the nose, the sinuses, ears, lungs, kidneys. However, it can affect other areas. Cause is unknown, and again, thought to be autoimmune. Most common in middle-aged adults. So signs and symptoms include frequent sinusitis, fever, chronic ear infections, loss of appetite, chest pain, and a cough with or without blood. Now, if you notice, some of these things, they could be anything. But eventually, you get what's called the triad. So you get these respiratory tract granulomas, you get the vasculitis, and then renal disease comes along with it. Now, one of the markers for this is what's called C-ANCA, and this is a protein that you would test positive for this. And again, question is this a hypersensitivity response, like an allergic response? Nobody's really sure. If untreated, it is fatal. So Churg-Strauss is a similar association to, or similar to Wegener's granulomatous, I should say, but it is associated with allergies and asthma, and there's no renal disease that goes along with it. This is most common in people in their 40s. So you can see these are lesions in the lungs, here, 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 even here, that occur with Wegener's. And Wegener's, they also have ulcers that occur in the soft palate. These ulcers can be so bad that they cause palate destruction. You can also see the problems that are occurring in the nasal cavity as well. Okay, so microscopic polyangiitis. This is necrotizing vasculitis in the small vessels, lungs and kidneys especially. They antibody response to drugs or bugs is what they say. So this is an autoimmune problem. Too many neutrophils in the blood vessels, and so giving a immunoresistant or immunosuppressant is what's going to work here. So the 5 most common clinical manifestations are kidney inflammation, weight loss, skin lesions, nerve damage, fever. And again, you can see what we call polymorphic nuclear antibodies, and those are just our macrophage in there. All right, so the last part that we're going to go over are tumors. So one of the tumors that we're going to talk about is called a hemangioma. This is a very common type of tumor of blood vessels. It is benign. And you have one type which is a capillary hemangioma. And these can affect the capillaries in the skin or in the mucous membranes of the mouth. Sometimes we also see these affecting the capillaries in our organs. This hemangioma is what you might see on a person who has like a birthmark, or the big strawberry type of birthmark, especially when they're first born, and then eventually over time that birthmark regresses as the hemangioma gets smaller. So cavernous hemangioma is mainly found in the organs, and but sometimes it can be found in the skin. And if it is found in the skin, it may become a cosmetic issue. And what I mean by that is it can become very large. And so you might have this hemangioma that takes over the entire face. And so it can cause defects, and obviously the person can be in a lot of pain, and it's very bad for the self-esteem. Pyogenic granuloma is where you see these rapidly growing red nodules on the skin and in the mouth, and microscopically resembles granulation tissue, so very similar to the granulomas that we saw before. So you see that right here. This is a pyogenic granuloma on the inside mucous membranes of the lip. There's also something called a glomus tumor, and or a glomangioma, and it's a very rare benign type of tumor, and it arises underneath the nails, on the fingertips or the foot, very painful, usually needs to be cut out, and you can see that right there. It doesn't look like a lot of fun. But again, it is a tumor, it is benign, so it's encapsulated and can be removed. Kaposi Sarcoma, this is a malignancy of endothelial cells. There's chronic, and usually we see this like in males who are of Ashkenazi descent. It can also be seen in people who have had transplants, African Americans, or just people, just Africans. And then it is associated with some AIDS patients. And again, usually what has to happen with Kaposi sarcoma is they have to, if it gets big enough, if the tumor's large enough, it can be excised, but they're going through radiation and chemotherapy for this. And this is just showing you the disrupted endothelial tissue. An angiosarcoma is also a malignancy of endothelial cells. It prefers skin, but it also is in the soft tissue, tissues of the breast and the liver. You can get angiosarcoma from arsenic poisoning.